Hey guys, Nick Sivrich, PT Answers Now. I wanted to do a quick video. Actually, before I say that, I wanted to let you guys know thank you so much for all the likes that you guys did for me. Thank you for sharing my last video, pages, all that stuff. I really appreciate it. But what I wanted to do, I wanted to shoot a quick video about what a physical therapist is, because obviously this page I created, for answers, for questions and whatnot about the profession itself. So I decided to do a little video about exactly what we do. By true definition, a physical therapist, as a physical therapist, we are healthcare professions that promote function, promote movement, decrease pain. If you look it up anywhere, that's kind of the gist of what you're going to find. What that means exactly? Well, it means that when you have a problem with your body and it's not working properly, we're the people to come see. Whether it's a pain that's causing this, whether it's decreased motion in a certain joint of your body, whether it's something that you can't do, whether it's a weakness, whether it's a postural thing, a structural thing in your body, we're the ones that come see. People come see us all the time for different reasons, whether it's after a surgery, whether it's after they've injured themselves doing an activity, whether it's just they wake up in pain one day, they have no clue why. They were in the yard raking leaves in the fall, and 2 days later they woke up in pain. Why am I in pain? Why does my back hurt? Why does my knee hurt? And that's the type of patients that we see. Now, that is also in the type of environment that I'm in. I'm in an outpatient orthopedic setting. So I deal with musculoskeletal injuries. I deal with any type of thing that has to do with that type of injury. There's other types of aspects of physical therapy, such as neurological physical therapy, people that have strokes, people that have traumatic brain injuries. There's burns, people that get burnt in traumatic incidents, whatever the case may be. There's burn units for that. Physical therapy does that. We do wound management. We are also in skilled nursing facilities. We do home health. All these types of environments, that's kind of where we're at and focus on. Cardiopulmonary. There's multiple ones out there, and there'll be different things that I post that kind of show different aspects and diagnoses that we treat. There's a lot to go over, and just from this little quick video, I don't want to get into that too much. But what I also wanted to get into is what we do as far as, say, on your first visit. So say you're thinking about coming to physical therapy and you want to know what to expect, especially on your first visit, because you've never been here. What's going on? What am I going to do? What are they going to do with me? Am I going to have pain? I've heard from, my neighbor Sally down the street said that it was the worst pain she'd ever been in when she went to therapy. And, that's not always the case. Sometimes, yes, you are going to be put in pain because you need to increase your motion, you need to strengthen something, and sometimes that can be painful. Other times it's very relaxing. It just all depends on what the therapist is trying to accomplish, what I'm trying to accomplish, and what the ultimate goal is that you want to be able to do. So I'll give you a quick rundown. Obviously you're going to come into the office. This is just for me personally, but some of these things other people will go through as well if they go to a physical therapist. So you come into the office. If you have a prescription from the doctor, we're going to take that from you. If you're coming direct access, which again, direct access, you can come to us without a prescription. You don't need to go see a doctor. You can come straight to us. Okay? Got it? Good. All right. So anyways, you'll fill out a form. We'll give you a bunch of different forms to fill out, HIPAA, Privacy Act, all these different things. And you'll have a health form that you fill out, different parts of the body you're having pain or that you're having trouble doing. You rate your pain, all that different type of stuff. Insurance card, whatnot. After that, we bring you back to a treatment room. Depending on what body part it is, we might put you in a gown. It just all depends. If it's your neck, your shoulder, low back, things like that, we usually get you a gown, especially if you're a female. If it's a lower injury, a lower body injury, we usually have you bring shorts. If not, I usually provide those for you. Once you're in the room, I come in. Obviously, I come in, introduce myself. And then I get started. And basically, what I'm going to start doing is I'm going to ask you a bunch of different questions as far as what's going on with you, how you did it, when you did it, what you did while you were doing it, what you had done. If you have no clue, that's when I start asking you different questions. So I take a pretty detailed history with my examination. After I take my history, then I go into my actual examination, and that's a hands-on examination. So I'm going to be putting you through a multitude of tests, depending on what body part it is, having you lift here, pull here, twisting you here and there, just to try and figure out exactly what's going on with you. Once I do that, then I try and come up with an actual diagnosis that I think best suits you, regardless of what the doctor prescription says, whether or not it matches up or not. It may not. It all depends on what I find, and that's what I'm going to treat. So once I figure that out, I explain to you exactly what's going on, because that's my big thing. I like to educate you even prior to treatment, what to expect as we're doing this. So I go through the whole diagnosis, what I think is going on with you, what's wrong with you, and then I proceed to tell you what I'm going to do for your treatment. And obviously I answer any questions that you may have back to me prior to the treatment even starting. So once that's all done and you kind of have a focus on exactly what we're going to do and what we can benefit from, then we go into treatment. Now, depending on what type of therapist you go to, where you go, some may use modalities, heat, ice, electric stim, ultrasound, cold laser, all this different types of stuff. Some might not. So it just all depends on where you go. But usually what I start you on is, I'll either go right into treatment. Sometimes I give you some heat, electric stim. It just all depends. But what I do is I like to do a lot of manual therapy. That's my big thing. That's my bread and butter. That's what I feel gives you the most value, the most success in treatment is manual therapy. So I do a lot of hands-on stuff, whether it's a stretching mobilization, whether it's a type of joint mobilization where I'm trying to get a particular joint to move properly, whether it's soft tissue massage, whether it's trigger point release. There's a multitude of manual therapies out there that a lot of different therapists do a lot of. And that's what I focus my main part of the treatment that you're here on. Then what I do is I usually give you a few different exercises to do, whether it's a stretch, whether it's an actual strengthening. It all depends on what we're trying to accomplish. So if we're trying to get you more range of motion, then it's going to be more of a stretching type of thing. If you're having trouble lifting things, or if there's a weakness that I find in the examination, then I'm going to try and do specific exercises for that particular body part. So once that's all done, depending on what you do first, whether or not we ice you down at the end, it just all depends. I go over everything with you. I make sure that you understand all your different exercises, if we modified anything, and that's your homework for the next time before I see you again. So next time you're in, it's kind of like a little bit of a quiz. We go over, with my aides that I have working with me. We go over your different exercises. We try and modify anything that you were having trouble with. And we obviously get into the next treatment next time you're in. But usually I'm upfront with people and my patients from day one that they are expected to do these at home. They are expected to try and help themselves, because just having me treat you and you come in and do your exercises here and that's it is never going to work. It won't. I don't care what therapist you go to, they will all tell you the same thing. And if they don't, they're lying to you. You need to do these things at home in order for you to get better, to have better success, and to promote your well-being and be able to have a healthier lifestyle. You need to do these on your own. Even after discharge, even after you're gone, I expect you to do these at home. Do my patients do these very often when they leave here? Probably not. I would hope that they do, but very, very few. Probably 1% of my patients probably actually continue these on their own after they're done. But that's what's expected of you. So, after you leave, or after you're done with I'm done with you, you go up front, you reschedule for whenever you want to come back in. I see anyone between 1 to 3 times a week. It just all depends on what we're trying to accomplish. The people I see 1 time a week are more people that are trying to phase out of their program, and I'm getting ready to discharge them. So the last 2 or 3 weeks, I'll maybe have them come once a week, and then they'll be done. Others I see anywhere between 2 and 3, depending on what type of diagnosis that I'm seeing, what I'm trying to accomplish, what I feel is best. If they're really far behind, they may need to come more times a week than what was anticipated. So, that's pretty much it. Like I said, there are a lot of different types of therapists out there, between outpatient orthopedic, like I said, home care. There are neurological, like I said, they deal with stroke patients, traumatic brain injuries. There's ones that are in burn unit, wound care, skilled nursing facilities, long-term acute care, anyone, multitude of different environments that we work in. But the one that I have always worked in is outpatient orthopedic. That's the one that best suits me. I just like to see results very quickly, compared to those other environments, and it's very goal oriented very quickly. So that's what I like. So that's all I got for you today. Please share this video, like it. Any questions you have at all, if you're a prospective patient, if you're someone that has more questions about any of this video or anything else, feel free to comment in the comments section. Shoot me a message on the page as well. And that's all I got for you today. So thanks a lot, guys. Here's to your health.